Okay, good morning, everybody. How you doing? Okay, so I'm going to do a quick video to answer a bunch of email questions. Y'all are having some trouble with this first chapter on endocrine. Okay, so first of all, let me cover a few things that I did in the weekly engagement for week 2. Just a few notes, kind of a real big picture, wave top procedurals, how you can succeed. So the first thing that you do for every week is you open up your textbook. It's in the syllabus. It's the tutorial text, and you should have it. If you have another one, that's fine too, but I prefer you to have that one, okay? Online versions, in my experience, are always more challenging because you can't tab them up as easily, you can't highlight them as easily. You could do those things, but I find it much more challenging, both as a student and for students as the instructor. So open up the chapter, read the summary of the chapter first, the end of the chapter, okay? Then go back to the beginning of the chapter and look at the main text headings, okay? Look at all the main darkened words. Look at the images and the graphs. Those are going to be extremely important. When you read the endocrine chapter, it's going to talk about all of the structures within the endocrine system. And the endocrine system is unique. And the reason that it's the first one in your lab is because it encompasses everything that you did from A&P1 all the way down into A&P2. Now we'll transition into cardiovascular next. So endocrine is going to be very important for you to understand the hormonal elements, okay? Now, granted, this is not your lecture, so you're not going to be going into the same level of the endocrine system as you would. And similarly, you would have talked about the autonomic nervous system in the lecture. You're not going to get that here, although it is important to understand the two. Now, if you want to know anything additional information or how we can put it together, or you might need some tutoring type of consulting, we can get on a phone or a video call, and we could talk about it a little bit more, okay? But again, this is an online course. I'm setting you up for success by giving you the procedural elements. It's your responsibility to go back and do the work. So if you've gone through the chapter and you've gone through the review of the chapter, the end, the summary part, which I like to use as the beginning of it because it helps to give me a big picture look at it first and then go back through the chapter. Then you fill out the anatomical structures because as you're reading through the chapter, there's the pictures. The pictures don't have to be the exact picture. Anatomy is anatomy. If you looked at one person and you looked at another person, do they both have a liver? Yes, but some of one person's liver might be slightly different or slightly larger or slightly smaller, okay? There are variations in those organ systems, and anatomical illustrations are the general, the most common, okay? Similarly, you're gonna have variations in heart structures. You're gonna have variations in nervous system structures. You're gonna have variations in digestive system structures. But the system is comprised of these structures, and these structures are comprised of these features, okay? And if you remember back to A&P1, it's a building block approach, right? So the tissues make up the organs, which make up the systems. Multiple systems make up an organism. And that's going to be the focus of our project. Multiple systems create a super system in the case of the endocrine and nervous system, and when they malfunction or there's some sort of pathology, they're out of homeostasis, and now we have a case study that we can discuss in a patient. What's wrong with this patient? What's the diagnosis? What systems are not working properly? And then how do we fix it? Following the anatomical structures, we go into the physiological structures, the physiological system, and then we look at the power physiology. We go through all the tabs on the top, and it'll give you the background. You read that. You give you the experiment. You do the experiment virtually. Then you do the data analysis, and then you produce the PDF. You upload the PDF to Lalima, and then the physiology assignment's done. Okay? Once that's complete, you now understand the anatomy, the physiology, the structure and the function. Anatomy is the study of structure, physiology, the study of function, and then how they work together. That's the discussion questions, which then you'll read the questions. If you haven't already, I would hope that you would have read them, or at least read them, so that when you were looking through the chapter, you would have been able to say, oh yeah, I'm going to get to that in a bit. And then you go back and you answer the questions. Easy day. Then you finish off with the weekly engagement, making sure that you summarize in briefly your participation in this procedure. You have 3 assignments. One's anatomy, one's physiology, and one is comprehensive. Very simple procedure. Now, where do you get the information from? I mean, did you take A&P 1 already? The same place you would have gotten it there. It's your textbook. It's Google. It's an anatomy atlas. It's the STEM Center site. I'm recommending all these various sources. What's required is the textbook. If you flip through the pages, you're going to see the pituitary gland. Where is it? You tell me. Where's the thyroid? Where's the parathyroid? You tell me. Okay? But I'll give you a hint. They're scattered throughout the body. So when it talks about the thyroid and parathyroid, you might not see it so easily in a torso model. At least those models are representative of the physical model in the lab. But you're going to have to look at the throat. And where would you find that? The respiratory system is going to show you the larynx. So you got to look in the respiratory system. And the thyroid, and where's the parathyroid? It's on the backside of the thyroid. They're little dots. Where's the thymus? The thymus is located right over the heart, like superficial. So if you're having a hard time navigating the structures, what's deep, superficial, lateral, medial, inferior, superior, to what it's inferior to this, it's superior to that, you need to go back to chapter 1 in A&P 1 in 141, and you need to refresh. You need to understand that you can't just data dump everything that you've learned in 141. For example, the torso model was chapter 1, or the first anatomical chapter in A&P 1. Sometimes it's broken down a little differently. At KCC, we do biology and chemistry, and then we hit anatomy, all within A&P 1. But it's the organizational structure of the body. What are the main systems? How many are there? What's the nervous system? You learned in A&P 1, you have systems. What are they? And then you should be able to tell me where the heart is. You should be able to tell me where the lungs are, the liver, the pancreas, the small intestine, the large intestine, transverse colon, which is the horizontal one, the horizontal element of the large intestine. Okay, the ascending and descending colon, the rectum, the bladder. Those are all those pictures. Okay, the larynx, the thyroid, the parathyroid on the back, the brain. Okay, the brain stem, the pons, the medulla oblongata, the brain stem. What else is on there? Your esophagus and your trachea, your appendix, your reproductive organs. The reproductive organ systems are going to be part of the endocrine system, right? So when you look at the endocrine system and it shows you a series of organs scattered throughout the body, well, the ovaries, all right, they produce a hormone. They're also a reproductive structure. So they're not just in one system. So I think what I like to see happen in this first chapter is I want to give you, without a lot of guidance, on purpose, how much effort are you going to put in to these questions on your own? And I've gotten 3 or 4 emails Where are these exact pictures? There aren't exact pictures. That's not how this works. Does the lungs look like the lungs? Yes. So you mean to tell me if I was to open up a picture book to a nurse and say, where are the lungs? And you say, that's not the picture I learned. I don't know. It doesn't work like that. The lungs are the lungs. You need to know where the lungs are. You need to know where the liver is. You need to know the small intestines, the large intestines. Okay, because as you get deeper into those systems, you're going to need to know the individual structures within those organs. That's just how this works. That's why this is the second part to A&P 141 and 142. Okay, so on purpose, I want to challenge you that those first questions, this torso model, this is a review of A&P 1. Okay, because if we were in person, okay, which I would hope that it would be a little bit more obvious, I would be quizzing you on, well, where's the heart? Well, it's not in your chest. Okay, that's not how we speak. Okay, it's 1/3 to the left, right? It's in the the pericardial cavity, the pericardial sac, within the mediastinum, deep to the sternum. Okay, what are the rib cages for? What is the rib cage for? It's for protection of the major organ systems. Well, what are the bones that protect it? Well, it's the rib cage, it's the sternum, it's the body of the sternum, it's the it's the clavicle. All right, so why is the clavicle relative to the lungs? And so later on in our pulmonary section, why is it a big deal for somebody if they break their collarbone, or they fall and hit their hand, and it's called fouche, fall on an outstretched hand, dislocate their shoulder and fracture their clavicle? Why is that important, especially in like athletics, for example, or a car accident? Well, first of all, because the clavicle is the only bone that holds the shoulder girdle on the axial skeleton. Okay, but more importantly, this tip of the lungs, the most superior element of the lungs, comes out right here, right underneath the clavicle. Okay, so if that fractures and it goes down, for example, you can puncture your lung. All right, so what's the relationship between the ribs, the clavicle, and the lungs? Well, they're there for protection of the lungs. Okay, it's a bony structure to protect it, but it's a problem if it fractures, because it's right there, and you're going to puncture your lung. Right, so that's just understanding the interdependence between one system and another system so far removed. Why does the skeletal system affect the pulmonary system? Okay, that's not so common of a question, but it's important because it gives you an appreciation for the relationship between multiple systems. And we'll have another video on this in a bit, talking about that, why that's important in cardiology, pulmonology, and endocrine system, and how that affects people's function. Okay, so my goal is to have you understand, not just memorize. If you're just opening up a textbook and you're looking at the picture and seeing which one matches, and I can't find the picture and I'm losing my mind, well, then you're doing it wrong. Okay, all right, so let me give you another quick tip. Out of 100 students every semester for 5 years or so, I don't know, something like that, okay, I get about, 1/3 get an A, 1/3 get a B or a C, 1/3 get an F or a D. Okay? The reason for those splits is simply they don't do the work. The Fs and the Ds don't do the work. They just don't submit anything. Okay? The Cs and the Bs fail the tests. The As do all the work and do well on the test and the project. Your main grades are your test and your project. Test and your project. You get 2 tests, you get 2 projects. All the homework is to prepare you for the test and the project. The better you do on these homework assignments, the more effort you put in, the easier those projects and tests will be. I don't care if you don't hit all the questions, because it's just going to be, you don't know the answers, you don't understand, you're going to fail the test. You're going to fail the class. I can talk to you in 5 seconds and know whether or not you're actually trying. I can usually tell by the structure of your email whether or not you're trying. Always present leadership, whether it's in a class, it's in work, it's to your parents, no matter what the situation is. And I apologize if I have grown students here and I'm preaching to the choir. I primarily focused on those who are just as fresh college students. Okay, so understand that. I'm not trying to talk down to anybody. I'm trying to give you real world advice. Always bring a solution to a problem before you ask a question. Always bring a solution to a problem before you ask the question. Don't ask me, how do I do this? Where do I get the answer? Tell me, I looked here and I looked here and I looked here. Okay? I think that it's here. Is that correct? Most of the time you're correct. In all of these classes I've ever taught, 9 out of 10 times you are correct. You're just doubting yourself. Okay? I can validate that doubt, not a problem whatsoever. Happy to get on a phone call, happy to get on a Zoom. In most of the classes I've ever taught, most students, maybe the exception of like a handful, have ever taken me up on any of that. Happy to get on this conversation to talk through it. You'll understand it better, but nobody ever asks to. Nobody ever gets on my office hours. So then what I've done is I've just stopped being on it every day. If you want to get on my office hours, just send me an email and I will open up my Zoom and there you go. I'm not going to sit here and wait for you because most people never show up. All right. I'm here to help you. Please understand that. Let me know if you need anything else, but you got to try a little harder because it's simply identifying a structure. Anatomical atlases are out there. Google's out there. It's just an organ system that you should have learned already. So try a little harder. I guarantee it, you can do it. Have a good day.